There's a new national poll done by Black to the Future and Socio-analitica where they talked to Black respondents, and they made it perfectly clear that economic relief, vaccination rates, as well as housing crisis are the most important issues facing African Americans. And so among this group, President Joe Biden has a high approval rating of 78%, Vice President Kamala Harris at 75%. Also, the top four priorities, 41% say they'd like to receive $2,000 monthly relief checks to pay for utilities and food. 36% want to see minimum wage increase $15 an hour. 28% want to see the administration address structural racism and white supremacy. And 28% want the administration to do more to protect voting rights. 55% of Black people say they have gotten at least one dose of the vaccine. 85% of Blacks over the age of 65 report say they are partially vaccinated. And so the top reasons people say they are not getting vaccinated, 58% say they need more time to see if the vaccine works. I don't know what the hell you're waiting for. 29% say they don't have transportation to go get vaccinated. 25% say they don't have a vaccine delivery site near their home. 24% say they are not sure that the vaccine is free of charge. It is free. Joining us now is Alicia Garza. She's a principal with Black to the Future Action Fund. They conducted the poll. Interesting results here, Alicia. And I want you to weigh in again what we're talking about. You've got voting, you've got marching, you've got folks who want to change public policy, but you can't change the public policy unless either you change the minds of the existing politicians or you change the politicians.
It's just you have to do both. We have to actually have a multifaceted strategy. And for us at the Black to the Future Action Fund, part of what we're trying to do here is place pressure on politicians who are making decisions about the issues that impact our lives every single day. We're incredibly concerned. And the reason that we did this poll and that we'll continue to do these temperature checks every 2 months is because what we're finding, right, is that there's not enough engagement with our communities about the things that we're experiencing or about the things that we want to see. And so we want to make sure here that Black voices, Black communities are being represented. And the way to do that is not just to wait for them to come to you, but to make sure that you're in their ear every single minute, talking to them about what's important to you, talking to them about what you want to see them do. And then when election time rolls around, if they are not doing what it is that you want them to do, you take them out and you put somebody else in there who knows that they need to be accountable to you. This poll is so important because it is showing that what Black communities across the country want to see is progress. You know, we've heard a lot of conversation happening recently about bipartisanship. We get it. But we also know that sometimes bipartisanship can be used as a cover to not be bold. And what Black voters did in November and in January was delivered a mandate. And alongside that mandate, we also delivered Democrats power. And so what we want to see happen from here is for them to use the power that we delivered them to make bold changes that are going to impact not just our communities, but everybody across the board. And that's what's important here. We really want to make sure that bipartisanship is not used as an excuse to not make progress and to not be bold. You'll see here in this poll that the Black people that we polled said, we don't want the filibuster to get in the way of progress. So if the filibuster is getting in the way, let's get rid of the filibuster. We understand very deeply that the filibuster and other procedural rules have been used to further entrench racist policies. And so we want to see those kinds of barriers removed. We also want to see progress as it relates to housing. We want to see progress as it relates to voting rights. We want to see progress as it relates to our economy. And so this poll is important because it lifts up, right, that despite the conversation that's happening in Congress, there's actually a gap there between what's being talked about in Congress and what is being pushed for in our communities.
When you look at these particular issues, obviously you have the economic piece, you have the housing piece, but it was very interesting on the vaccine piece. And as I looked at those numbers there, it really illustrates why I have been highly critical of the Biden administration. I've been critical of Forrest Marsh, the advertising agency that got the contract with the Department of Health and Human Services and the CDC. Let's be clear also, that agency, its entire leadership is white. not a single African American. And so when you look at these numbers, when you talk about the transportation piece, when you say they don't have a vaccine delivery site near their home, and then 24% say they're not sure the vaccine is free of charge, I've been saying this is what happens when y'all don't provide some of that funding to black-owned media to get those things out. You're trying to rely on other folks. You know, you got to be able to do it. What's interesting here, Alicia, we literally put together proposals where we said, let's pair up black media-owned media outlets with mobile vaccination plans and say, hey, Wednesday, meet us here. We're going to have 300 vaccine shots. We're going to vaccinate the first 300 people who actually show up. Folks didn't respond. They didn't respond to it. And then all of a sudden it's like, oh, now we realize that we need to have a more targeted approach. And this is part of the problem. When you have folks who are not handling business, and then you see these sort of responses, which goes right to why you have low vaccination rates among African Americans.
That's right. Well, there's a lot going on here, Roland, and you're absolutely right. There's a huge information gap that is literally placing black communities under duress and under attack. You know, our communities do need information about this vaccine, but we also need access to it. And you know that at the Black to the Future Action Fund, last year, we released a plan for relief and recovery from COVID-19 for Black America. And part of what that plan looked like was also making sure that we're investing the resources to ensure that information is getting to our communities about the vaccine, but to also increase resources that help expand access to the vaccine, things like transportation, things like targeted and tailored campaigns to our communities. We said a long time ago that it wasn't going to work, right? To just try to put black celebrities on television and think that that's what was going to encourage our communities to get vaccinated. Actually, what we found from our polling was that the thing that tipped people's perspective, right, was if somebody they know had gotten the vaccine. We heard a lot that, if people saw the President Obama getting it or another celebrity, that they would think that they got some special dose, right? But if you are talking to, people in your community, people that you trust, that those vaccination rates would go up. So I do think the administration has a huge challenge here. One of those challenges, of course, is that with this rollout, there was not enough information given about this vaccine and why it's important, what it does do and what it doesn't do. But then, of course, the other thing is that we didn't resource communities to make sure that that vaccine was distributed widely and equitably. There are still people who think that the vaccine is not free. There are people who think that, they're getting injected with COVID. There are people, right, who say that their number one barrier is that they can't actually access a site where they can access the vaccine. And then, of course, right, we didn't do a lot of information about the effects that you will have with the vaccine. So we told everybody to get the shots, but we didn't actually go into resourcing or helping people better understand what those side effects might be. So we do have a big issue here. And unfortunately, because this was in a lot of ways used as a way to demonstrate the effectiveness of this administration, I do believe that there were many shortcuts that were taken, and we are all now reaping the consequences of those shortcuts.
Questions from our panel. Scott, you're first.
Hi, Scott. Thanks, Roland. Scott Bolden here. On your list, if you pull that list back up, I thought it was interesting that the reasons that black folks weren't getting it were completely different than the 50% of America, those who are Republican, what their reasons are. They don't trust the source of the government. They don't trust the government. They don't trust the source of the private company, or politically they're Republican and they don't trust anything. If you compare that list to that group, clearly black people, if they have access to the vaccine based on your research, they would get the shot. I think only a small percentage said they needed to learn more about it. Am I right about that?
That's correct. I mean, so here's what we're facing here. Unfortunately, what we find, again, is that prior to this pandemic, the infrastructure in our communities was already weak. And then when you add on top of that a global pandemic that's putting extra pressure on already weak infrastructure, of course, you see the gaps emerge. And here where we're seeing people saying, you know, I would do it if I had transportation. I would do it if I had this. These are reflective of longstanding issues in our communities. And so I do think it's important for us to kind of acknowledge, right, that racism plays out in all of these different ways. I say to people all the time, racism is not about people being mean to each other, and it's certainly not always about people burning crosses on your lawn, right? Racism is about power and who has it and who doesn't, and it is a mapping of power. And so when you look at kind of all of these reasonings and the differences in the reasonings between what Republican respondents might say about why they won't or haven't taken the vaccine and what Black folks are saying, right? And Black folks, obviously, you know, largely Democrat, then you see actually some of the racial disparities that influence the decision making that Black communities have access to or don't.
Exactly. Thank you.
Next question is Kelly.
Hi. So, given this survey, what do you think the messaging should be to encourage people to get vaccinated? Because if the information is out there regarding, yes, it's free, if the information regarding how to get there is out there, it seems as though the shaming campaigns don't necessarily work in some jurisdictions. So I'm curious, just for your thoughts, as to how to get the message out there that yes, it's good. Because the other prong that I saw of them wanting to wait to see what happens, frankly, we don't have that kind of time, because the longer you wait, the more chances there are for another variant to emerge and be prevalent above the Delta variant. So I'm not necessarily worried about those who think that they need more time. We don't have more time, but for the others who have those more legitimate concerns, what do you think the messaging should be at this point?
I actually think it's bigger than messaging right now. I think it's actually about putting resources in communities and making sure that people have access to those resources. So I think that the federal government needs to work with state and local governments and set up transportation. We know that we've got, you know, private companies like Uber and Lyft, right, that are doing free rides to clinics. But we actually need more than that. And we need to not just be relying on the corporate sector, right, which is largely unaccountable to government. We need to rely on government to invest resources to make sure that there is transit in communities that people can access. We need to make sure that there are more vaccines in communities where Black folks are. And we need to make sure, right, that the access to that is unfettered. You know, I'm here on the East Coast this week, and you know, with the new mandate that people need to bring their vaccination cards, lots more people are trying to get vaccinated. And they're showing up at Walgreens and they're showing up at CVS and they're being told they don't have any more vaccines. So imagine what that looks like, right? That was in Soho in New York City. So imagine what that looks like in a place like Enfield, North Carolina, right? Imagine what that looks like in a place like Birmingham, Alabama. We've definitely got to stop talking about it and actually place the resources in people's communities so that they can get to it easily, quickly, and effectively.
Brianna.
Yeah, so I do want to touch on the concept of people stating, let's figure out, or I don't know enough about this, or let's wait for time. And so addressing that, I did my own research, right? So I didn't have the whataboutisms and stuff like that. And it was under my impression, which I would love to hear more of what you know, but the mRNA technology has been studied for 3 decades, and it's not new, and that they use it for other human therapies. And there just wasn't a way to create this vaccine because there wasn't enough money. But once this pandemic happened, it opened up the floods for this, for the ability to complete the work. And we know now that Pfizer is FDA approved and Moderna's finished submitting their application to be FDA approved. And really what cemented it for me is that when you get the vaccine, right, it puts the mRNA particles in, and after 24 hours, it's completely gone from your own body, and the foreign stuff is gone. And so the ingredients that the vaccine has creates your own what your own body makes, and that's what stays. So it's your own body, and so. We already know what the long-term effects of COVID happens, and we haven't seen any long-term effects with the vaccine. And my great-grandmother, who I'm blessed to still have with us, has been through a while now, about to get her booster shot this month, her third booster shot this month, and nothing's happened. And I personally know people who've died from COVID. So I would like for you to talk a little bit more about, how we've had this technology for 3 decades, and this just didn't happen overnight, and how, we convey more of that to people who are thinking that this was too quick.
Yeah. Well, I think it's an important question. And I do want to make the point that, when there is an information gap, in this day and age where there is a ton of misinformation and disinformation, conspiracy theorists, right, including one that we had as a president, it creates room for people to fill the gap of what they don't know. And I think that this is something that is important for us to understand. Misinformation and disinformation campaigns are also not new, and they are targeted at Black communities in particular. Roland, I saw you this week giving Busta the business about the way he was using his platform to spread misinformation.
Had to do it.
It's a lot. It's a lot. And so here's what I think we need to do. Earlier, Roland, you were talking about Schoolhouse Rock. And I do think it's important, right, that we are making this information as clear and as crisp as possible. None of us are doctors, right? And so it's hard to grasp some of the technicalities of the thing. But I do think what we need to be able to do is explain to people in very simple terms what this does do and what it doesn't do. And they need to be able to hear that from people that they trust, people that they don't think have an ulterior motive or agenda. And unfortunately, I think what we're seeing is that we have a lot of different messengers because people don't know our communities, and so they're using approaches and tactics, right, that might work for white folks, right, but they don't work for us. And so we've got to shift that. I will also say here that, we have to also be honest about the vaccine. So I read an article this week in Yahoo News that said that actually the vaccine regimen was always supposed to be 3 shots, but that they were actually rolling it out and trying to get it out there so quickly because there was so much devastation that they were just kind of rolling with the 2. And that's important, right? People I know, once they started seeing other folks getting the shot and people were experiencing side effects, it was scaring them. Nobody was actually saying to you, hey, in that second shot you take, you might, feel sick or something for 24 hours. So what we're going to do is we're going to incentivize employers and business owners to give people a sick day so that they can go and get vaccinated. These are the kinds of solutions that we need to address. And it really involves, right, taking a look not just at people in general, right, using a neutral approach to communities, but really targeting what is going on in various communities and what are those barriers and how do we overcome them? What's happening in Black communities is unique and specific. And so we need to tailor solutions to particular constituencies to make sure that we're successful. We have been saying this for a long time. Between political campaigns to, social outreach about social issues, you cannot use a race-neutral approach when it comes to Black communities. It just doesn't work.
All right. Alicia, where can people actually go to actually see all of the poll?
You can go to thefuture.org and check it out on our website. We will also be doing these polls every 2 months. And so you'll be able to see in real time how opinions are shifting or changing and how the issues and priorities that we care about are shifting and changing. We really want to make sure that we're keeping you up to date. So visit us at blacktothefuture.org.
All right, then we surely appreciate it. Thanks a lot. Always glad to have you here. Whenever y'all have your information, all you gotta do is let us know, and we'll put it out there so the public is getting real information and not getting medical advice from Busta Rhymes or Tank.
Lord have mercy. Thank you, Uncle Ro. Thanks for having us.
I appreciate it. Thanks a bunch. Back to our Roland Martin Unfiltered video in just one moment.
Football bands and one of the best fan experiences in the country. The Cricket VACCINATION Challenge kickoff returns to Atlanta on August 28th along with special guests. College game day. Then Alcorn State takes on North Carolina Central with conference bragging rights on the line. Center Park Stadium is the place to be on August 28th. Come tailgate all day before enjoying a primetime matchup on the gridiron. You don't want to miss this. Check out MEACSWACChallenge.com for more information.
And, of course, folks, join Roland Martin Unfiltered in Atlanta Friday and Saturday for the SWAC MEAC Challenge. Friday, we'll be broadcasting live from the Atlanta Braves baseball game. We'll be hearing from the commissioners of the SWAC and MEAC, plus school presidents and other great guests. On Saturday, we'll be from the Coca-Cola fan zone at the stadium where the game is taking place. We'll be broadcasting live. Some great things going on. Tigger's going to be spinning. They got some chefs out there with the Coca-Cola kitchen. We're going to have some phenomenal stuff for you. Plus, we'll be live streaming the halftime show and the concert after the game. Check out Roland Martin Unfiltered on Friday and Saturday. And we thanks all of this in partnership with Coca-Cola, the SWAC MEAC Challenge. We'll see y'all there.